replacement therapy, or HRT, is in short supply nationwide, leaving many patients struggling to get the medications they need. Dr. Tamara Beckford with Truly Balanced Wellness Care joins us now to talk about the problem and share solutions. That's a really important part. Welcome. Thanks for being here.
Absolutely.
We've had some viewers tell us, I can't get my estrogen, specifically the patches.
Yes.
What's going on with that?
Well, the FDA was able to release the black box warning at the end of last year. With that, there have been an over 50% increase in prescriptions that's been written. And therefore, the supply and demand, we're now dealing with the aftermath of that.
And so it's coming in from both places. Doctors probably feel more comfortable prescribing it, so they're offering it as an option.
Yes.
Patients are hearing about it, so they're asking their doctors, and those collide. So there's
Absolutely.
just not enough of the product.
So we're not having enough of the product, and therefore, what's happening, I'm calling it the pharmacy shuffle. So we have patients that are getting their prescription. 1 month it looks like this, and the next month it looks like that. And sometimes they might not even be able to find it at their pharmacy that they're used to.
So it's the same thing, just different companies who are making it, and whatever company has some, then you switch over to that.
Absolutely.
That's a little overwhelming.
It can
What
be.
are you suggesting to patients right now who are having to deal with the shuffle?
So one thing that you can think about is we have the large chain pharmacies, but we do have some independent small pharmacies. So think about them. They might be able to use a different distributor, so they might have those medications. If, however, there's no medication around, such as the estrogen patch in specifically speaking, then you can use other versions of these hormones. So we have the patch, however, there's also the gel form that's still transdermal, and there's also the spray. And if you're unable to take any or find any of those, your provider, such as me or anyone else that helps you with your menopause, will be able to write you for the estrogen pill, but they're going to make sure they talk to you to make sure that you have no risk factors for blood clots.
Yeah, that's really good to know.
Yeah.
Now, as far as that's concerned, if you are on the patch and you just can't seem to find it anywhere, and you switch to one of these other ones, you're not going to have any other type of symptoms. It's going to be like you can't even tell that you've switched forms.
Well, the difference is that they're both transdermal, so they're not going through the liver, which is the difference between the transdermal and the oral version.
I see.
So you might maybe notice a small amount of difference, but overall you shouldn't, because you're getting the estrogen into your stream and it's doing its job, and that's what we want.
For women who have just not been able to get it, and we have talked to some women who are in that situation, what type of symptoms are they going to experience if they are off for estrogen for a while?
Well, they'll probably notice some of their perimenopausal or menopausal symptoms, such as the hot flashes, the mood swings, the waking up in the middle of the night, not being able to concentrate, which is the infamous brain fog. So those are some of those symptoms that you'll start to notice.
And so what would you suggest right now for a patient going through this? Because I feel like doctors' offices who have a ton of patients aren't going to probably be able to make those phone calls for you, even though they want to, right? So in this situation, is it the patient's really responsibility to be making those phone calls to pharmacies to see who has it?
Yes. If I were a patient, and I am, and you're going down to your last box, contact your pharmacy. Find out, do you have this medication in stock? Do you expect to have it in stock anytime soon? If not, then I'll start trying the small independent pharmacies.
Okay, so then you just start making those phone calls, and even if you've never used them before, they are able to tell you whether they have it and are going to have it in the weeks and months ahead. And they're able to tell if they will have it next month?
Some of the pharmacies might not.
Okay.
Yeah, that's the unfortunate thing, because, and I mean, as like they said, I'm also a patient, so I've had notice. If you notice, there are two different prescription, there are two different companies, I should say here. So the supply chain, it's iffy, but it's up to you, because the medication is so important for us, to take the onus into your own hands, contact these pharmacies, and make sure that they can provide those medications.
It's really good to know that there are options out there, and I'm thankful you took time to come by and talk to us, and hopefully give everyone a little peace of mind on all of this.
Yes.
Thank you so much. Dylan?
It is Black History